Hello, Henrik. How are you today? Yes, I'm going to be your doctor, okay? My name is Dr. Dark, okay? So, first and foremost, before we get started, okay, I just want you to tell me a little bit about yourself, okay? Just a little bit about yourself, okay? And I'm just going to chart it down here. Is that okay with you? Okay. So, let's see. Let's see here. Okay. Alright, can you just tell me your full name? Okay. Okay, and when's your date of birth? So that would make you how old? Okay. Okay, great. And what's your current address? Okay, did you tell them out front so they can update that? Okay, great job. Okay, good. And are you currently on any medications that I should know about? Okay. Okay, and how many times a day do you take those? Okay. Is there any side effects that you are having because of your medication? Okay. Okay, on that one, just that one? Okay. Alright, I've got that down. Have you been feeling any dizziness, nausea, upset stomach, headaches, anything like that lately? Okay. Okay, so it was the other day. Okay, and how long did the headache last? Okay, just an hour. Okay. Did you take any ibuprofen or Tylenol? Okay, and that subsided it? Okay. Alright, Hendrik, well that seems great, okay? That seems really good. So, let me just sanitize my hands real fast, okay? Let me just sanitize my hands real fast, and then I'm just going to put some gloves on, and I'm just going to check your lymph nodes, okay? Is that okay? Alright, let me just get these on. Okay, so when was the last time you were here? Okay, and what all did they do for you? Okay, so it's been a little bit. Okay, well that's good. Let me just get these silly little gloves on, okay? Alright, I'm just going to be touching your face. Is that okay? Alright, okay, let me just feel you right here. Okay, and then I'll just feel right over here. And then on this side, okay? Just let me know if anything's tender, okay? Or if it hurts or anything, okay? I'm just going to palpate right here on your cheeks. And then I'm just going to go right up here on your forehead, okay? Alright, I'm check the lymph nodes right here, okay? Okay, now swallow for me. Okay, alright. And I'm just going to go the rest of the way down your neck. Alright, I'm just going to check behind your ears, okay? Alright, okay. Okay, can you swallow again for me? Okay, good. Okay, and I'm just going to palpate right here. Okay, your skin seems to be really good. Okay, you seem to be having a really good reaction. Okay, so any good reaction, that's good. Okay, so, okay, now I'm just going to get you to turn around for me. I'm just going to feel your back, and I'm just going to have you cough for me, okay? Alright, so I'm just going to rub up and down your spine right here. Okay, I'm going to knock on it a couple times. Okay, feels good. Have you been feeling any congestion lately? Okay, no? Alright. Okay, so I'm going to get you to cough for me. Okay? Yeah, cough twice. Okay, 1, 2. Okay, good job, Henrik. Good job. You're doing good. Okay, now I'm going to get you to cough again. 1, 2. Okay, good job. Okay, so now I'm just going to be just listening to your heart and your lungs, okay? Just for 1 second, okay? Just to make sure everything's looking good, okay? So, this thing, it's going to be a little cold, so I'm going to warm it up for you. Okay, just going to warm it up a little bit for you. Okay, so turn back and face me. Alright, so I'm going to put this on you, and I'm going to need you to take a deep breath, okay? Deep breath in, and then deep breath out. Good job, Henrik. Okay, deep breath in, and then another one out. Deep breath in, deep breath out. Okay, one more time on the front side. Deep breath in, and then deep breath out. Okay. Okay, can you just cough for me? Okay, good job. Okay, so I'm going to have you turn around, and I'm just going to check your back, okay? Alright, so right here, let me warm this up a little bit again. Okay, good. Okay, deep breath in, and out. Deep breath in, deep breath out. Good job, Henrik. Deep breath in, deep breath out. Good job. One more time. Deep breath in, deep breath out. Okay, good job. Now I'm just going to get you to cough twice. Okay, good job. Okay, so that seems very good. Okay, your lungs and your heart sound really good, which is very good. So I'm just going to check your chest, okay, real fast. And I'm just going to make sure, okay, that your skin's not irritated, okay, or anything. So just hold real still for me, okay. Let's get right here, okay. So your clavicles look really good. I'm just going to knock on them, okay. Okay, they look really good. Okay, so now I'm just going to be taking your blood pressure, okay. Alright, so, and then after that, I'm just going to chart your vitals, and then we'll get started on the rest of the exam, okay? Does that sound good? Alright, good. So, let me just take this, okay? Hold your arm out for me like this. Okay, good job. And I'm just going to wrap this in, okay? So, okay. Thank you. Okay, I'm just going to put it right here. And right there, and I'm just going to hold it, okay? Alright, so just let me know if anything hurts, okay? Okay, I'm just going to turn this on, and we're just going to feel, okay? Okay, yeah. I feel it. Okay. So, it's telling me that your blood pressure seems really good, okay? You don't have a history of high blood pressure or anything, right? Okay. Alright, good. So, I'm just going to take this off of you. Okay. Good job. Okay, great. So, I'm just going to chart that down, okay, right here, and I'm just going to write it down. Patient's blood pressure is really good. All vitals check out. Okay, so that's really good. So, now, let me just see back to your skin. Okay, I'm just going to check around the eyes, okay? Next, we're just going to do a little bit of an eye test, okay? Is that going to be okay with you? Okay. Okay, and you can see me through that. Okay, you see me through that. Have you had like any tenderness around your eyes or any blurred vision or anything like that? Okay, no? Alright, that's a good thing. So, let me just see. You can see me through that way. And then what about here? And what about here? Okay, good. So, before we get started on the eyes, I'm just going to take your temperature real fast, okay? Just do a little quick tip. Just going to take that temperature real fast. So, let me just get, okay, just open your mouth for me, okay? And I'm just going to place this in here for 6 seconds. 1, 2, 3, 4, 5. Okay, good job. Alright, your temperature looks really good. Okay, so you're not running a fever or anything. Have you been feeling feverish lately? Okay. Alright, so I'm just going to bring in this light, okay? And I'm just going to be checking your eyes. Is that going to be okay? Alright, so just hold real still, okay? It's just going to be right here, and I'm just going to be checking your eyes. Look at me, okay? Now look to the left. Okay, now look to the right over here. Now look up for me, okay? Alright, now look down, okay? So your eye seems to be really good, okay? No, I see no waterness, okay? Nothing, no dryness, not too wet, not too dry, okay? No irritation, no inflammation. Your right eye is good, so now I'm just going to check your left eye, okay? Alright, I'm just going to come in with this light again, okay? Don't be worried about the brightness of it, alright, now look up for me, okay? Now look down. Alright, now look to the left for me, Henrik, okay? Now look to the right for me. Alright, so not too wet, not too dry. Okay, this one seems really good too. Okay, so all your eyes look good. Okay, let me just palpate around them again. Okay, so I'm just gonna chart that real quick, okay? I'm just gonna chart that and write that down right here, okay? Okay, your eyes check out. Okay, great job. So then I'm just going to make sure that you can see all these letters, okay? Is that okay with you? All right, good. Good job. You're doing a really good job, Henrik. I hope you know that. Okay, so it's going to be mirrored, so it's going to, it's going to kind of be backwards, but that's okay. Okay, so what's this letter? And what about here? Okay, P, yes. What about now? Okay. And then what about back here? What's this? P again? What about this one? What about that one? Okay, good job. What about this one? It's a Z, yes. What about this one? Okay, you can see that. What about this one? This one right here? This one right here? Yep, it's a C. And then what about this one? Yes, it's a P again. And then what about this one? E. And then what about that one? L. Okay, and then this one? Okay, yep, that's it. Okay, you did a very fantastic job, okay? So, now to move along with the eye exam, I'm just going to be showing you some colors, okay? And you're just going to tell me what colors they are. Okay, here's the object. Okay, it's just a regular book. Okay, so you're just going to tell me what color is this house. Okay, alright. Okay, now what color is this? Okay, good job. And then what color is this? Black. Okay, good. Good job, Hendrik. And what about this? White. Okay, good job. What about down here? Okay, orange. Yep. And what about down here? Black. Okay, and then what about this sticker? Okay. What about this one right here? And then this one? Okay, so now we're just gonna differentiate some of these sentences. Okay, and you're just gonna tell me. Alright, so let's see. What does this say right here? Okay, alright, good job. Alright, now what does this one say? Alright, great job. So let me find one more page, okay? Just one more page. Okay, you can read the last line to me. Okay, just read the last line to me. Oh, wow. Good job, Henrik. You did it. Okay, so our eye exam, you passed it. You did very well on it. Okay, everything seems good. Okay, Henrik, now we're just going to be moving on to your ears, okay? Making sure you can hear. Can you hear my gloves? Okay. What about when I bring it back here? What about back here? Okay, and can you tell me whenever the sound, like, gets, just a little louder? Okay. Alright. Okay, now tell me when it gets louder. Okay. Alright. Good job, Henrik. Okay, so I'm just going to have this pen right here, and you're just going to tell me how many clicks, okay? Okay. 2. Okay, and what about over here? 3. What about here? 5. Okay, what about here? 1. Okay, and then what about here again? 3. Okay, great job. Okay, so I'm just going to come over here, and I'm just going to check this here, and I'm just going to clean it for you, okay? Alright, so let me just see over here. Okay, I got right here. Okay, I see a little bit of dryness around the ears, which is normal, okay? Don't be too worried about that, okay? So I'm just going to touch the ear right here. Okay, I'm just going to tap on it. Okay, good job. So I'm just going to be taking one of these Q-tips, and I'm just going to be getting in there, okay? So just hold real still. Okay, hold real still, Hendrik, okay? I'm just getting it. Just let me know if anything hurts, okay? Just let me know. Alright, okay. So that one seems to be clean. Can you hear that? Is that a nice crisp sound? Okay, good. So I'm just going to go over to this one, okay? I'm just going to do the same thing. Okay, I'm just going to tap around this one. Okay, I'm just going to look at it. Okay, there's some more wax in this one. This one has more wax than the other one, so I'm just going to take a Q-tip, and I'm just going to get that out right here. Okay, hold real still, Hendrik, okay? You're doing an amazing job, okay? Okay, let me just get that out. Okay, alright, great job. So I'm going to take this, and I'm just going to clean up the excess, okay? So just hold real still. And then this side. Okay, great job. So I'm just going to test again. Can you hear this? And what about this? And what about back here? And what about right here? What about right here? Okay, what about right here? Right here? And then what about right here? Okay, great job. Okay, so I'm going to be looking at your skin real fast, okay, just on your shoulders, just on your neck and stuff, okay, just to make sure that you're not allergic to anything or that it's not inflamed, that can cause any infection or anything. So let me just look. Okay, right here, I'm just going to be looking on your chest a little bit, okay, let me just pull down your shirt just a little bit, okay. Alright, okay, now I'm just going to be checking your shoulders. I'm just going to tug your shirt over here this way. Alright, okay, so I do see I may need to take a skin sample and send it off to the lab, okay, because I do see a little mole right here. Let me just get a light and just make sure. That, yeah, okay, so it's a little unsymmetrical, so I am going to be taking a sample of that, okay, and don't worry about it, it shouldn't hurt, don't worry about it. So let me just see over here. Do you have any more moles over here? Okay, alright, let me just check. Okay, alright, Okay, well that side seems to be doing good. So what I'm going to do is I'm just going to put some cream on that, and then I'm just going to take a skin sample and we'll just send it off to the lab, okay? Okay, so let me just put a little bit of this cream. I just got some of this cream on there. Okay. Okay, and I'm just going to rub it on there. Okay. Can you bend your shirt down for me just a little bit? Just a little bit more? Okay. Thank you. Alright. So I got that one on there. And then I'm just going to take this and we'll just send it off to the lab. Okay. Okay. So just hold real still. Henrik, let me just get that off your shoulder. Okay. Okay. So now I'm just going to take this and put it in here. And the lab people will come and pick it up, and then I will give you a result at the end of it, okay? But it shouldn't be much to worry about, okay? Alright, so I'm just going to write this down real quick that I sent that off to the lab for you. Okay. Okay. And I'll just need you to sign right here because it is, you know, we do have to send it off. So just sign right here for me, Henrik, okay? No, you can just sign right here. Alright, thank you so much. Okay. Alright, so we're just going to have that. Next, I'm just going to be testing your reflexes, okay? So I just need you to hold your arms out like this for me, okay? Like this, okay? And I'm just going to be tapping on it, okay? I've got these two instruments, and I'm just going to tap for you, okay? All right, let me just see. 1 second, okay? Let me just tap down here. I'm just going to go from your shoulder all the way down, okay? Just to see, okay? Tap right there. Okay, now hold out your other arm, okay? Okay, so now I'm just going to go right here on your chest, right here, okay? Alright, so now I just need you to sit back down and sit up straight, okay? Put your shoulders back, okay? I'll help you, okay? I'll help lift you and put your shoulders back right here, okay? Good job, Henrik. Okay, so now I'm just going to get your knees, so just hold still, okay? Just hold still. This may hurt a little bit, but it shouldn't hurt that much, okay? Hold real still. Okay? Okay, good job. So now I'm just going to take your elbow and I'm just going to get right here. Okay, so bend your elbow like this for me. Okay, now bend your other one like that for me. Okay, great job. So let me just check your head real fast. Okay, I'm just going to check your temples just right here just to make sure, because I know you said earlier that you was getting some headaches. So just going to make sure. Okay, do you have a headache right now? Okay, no. Okay. Do you know when you usually frequent these headaches? Like, are you doing anything like exercising or working, or are you stressed out or anything like that? Okay, you're usually stressed out. Okay, well, that's usually a tension headache, so we're really going to try to, you know, relieve some of that stress. So what I'm going to do is I'm just going to give you a quick little head massage so it can relieve some of that stress, release some of those, you know, those strained muscles, okay? Alright, I'm just going to warm up my gloves real fast, okay? And then I'm just going to come up here and I'm just going to give you a little quick head massage, and then I'm just going to go like here on your temples real fast, okay? It's usually in this temple, right? Okay. Alright, and then I'm just going to go on the top of your head right here. And I'm going to come down and I'm just going to reach around the back, okay? And get the base of your skull where your neck is, okay? Alright, okay, yeah, I feel those muscles are really tense, okay? So we just want to try to not stress out. I know it's easier said than done, but we really got to make sure that we're not stressing out, okay? So we can be as healthy and happy as possible. Okay, so how does that feel? Okay, great job. I'm just going to dispose of these gloves. Okay, I'm just going to put them over here. Okay, Henrik, I'm just going to be doing a sensation test. Okay, this is just to make sure that your cranial nerve is working good. Okay, so we're just going to be doing a test called the sharp and the dull test. Okay, don't worry, it's not really, you know, sharp. Okay, so this is what's going to be considered sharp, and I'm going to let you feel it. Okay, right here. Okay, so that's going to be considered sharp, and this is going to be considered dull. Okay, you can feel it. You can feel the bristles on it. See, they're both really soft. So this is going to be what's soft. Okay, so I just need you to close your eyes and hold out your hands like this. Okay, good job. And I'm just going to run this down them, and you're just going to tell me which one is which. Okay, close your eyes. Close your eyes for me, Henrik. Thank you. Okay, first we're going to start with this one on your left arm. Okay, Sharp. Okay, what about now? Dull again. Okay, and what about this one? Dull. Okay, and again? Dull. Okay, and what about this one? Sharp. Yes. Okay, so give me your right hand. Okay, so give me this one, and you're just going to tell me which one it is. Okay, starting off. Dull. Okay, good. Now what about this one? Okay, sharp. And then again. Dull. Okay, and then what about this one? Sharp. Okay, one more time. Sharp. Okay, great job. Okay, so your senses seem to be doing well. Okay, just hold out your palms because I'm just going to be scratching them a little bit just to make sure that the skin on your palms is good and it's not inflamed or anything, okay? Because that's a place that most doctors don't check and they can get inflamed, but I like to do that, okay? So I'm just going to be checking. Okay, I'm just going to check your fingers and check in between your fingers, okay? Alright, do you work outside with your hands a lot? Okay. Alright, just checking for any blisters on your fingers. Do you play guitar, any instruments, okay, that could make you have any blisters? Okay. Alright, so let me see your other one, okay? Alright, just checking in between your fingers. I'm just spreading them apart and just looking. Alright. Okay, now turn your hands over and I'm just going to check over here. Okay, and then right here. Alright, so your hands seem good. Okay, so everything has went really well today. So first and foremost, I'm just going to... Okay, Henrik, so next, first and foremost, I'm just going to be looking into your mouth. Okay, we're just going to be checking your ear. We already checked your ears, so I got to check your nose and your throat and your sinus cavities, okay? Alright, first I'm going to put some hand sanitizer on, okay? Okay, let me just rub that in before I put my other gloves on, okay? Okay, so I got these ones. Okay, so this shouldn't hurt at all, okay? But if you do feel any pain on the inside of your mouth, just be like, Dr. Dark, okay? And we will note that and we'll figure out, okay? So, alright, I just need you to hold your mouth open for me, and I'm just going to bring in this light again, okay? So hold your mouth open. Let's see. I'm just going to suppress your tongue. Let me find my tongue suppressor. Alright, here we go. Alright, open your mouth for me, okay? I'm just going to bring in this light, okay? Alright, go, okay. Alright, so your throat looks good, okay. Your lymph nodes weren't swollen, so that looks good. Let me just see over here. Okay, so I see right there, you do, on that tooth, you do have a cavity. Unfortunately, I'm not a dentist, so what I will do is I will write you a prescription, okay, for some antibiotics, just in case it's infected or whatnot, and then I will send you off to a dentist, okay? Alright, so let me just look right here, okay? Good job. Say ah again. Say ah. Okay, good job, Henrik. Okay, right here, right there. Okay, keep your mouth open for me, okay? So I'm just going to put some of this little Aura gel on it, okay? It's just going to numb that area so it's not hurting, okay? Okay, so just hold real still. Let me just get that right there. Okay, and I'll put a little bit more right here. Okay. Hold your mouth open because I'm just going to rub it in, okay? Okay, I'm just going to hold your mouth open. I'm just going to rub it in right up here. Yeah, it shouldn't hurt, so don't worry about that. Okay, so let me just look at your mouth. Okay, can you close your mouth real good? Okay, clench your jaw together like this. Okay, so bite down, but don't bite down on my fingers, but don't bite down too hard, okay? Alright, so let me just check the inside of your cheeks. I'm just going to hold it, okay? I'm just checking for any lesions or tears or anything, okay? Alright, stick out your tongue, okay? Let me just check, okay? Alright, okay, and then I'm going to check your other cheek. Okay, there seems to be no blisters, lesions, tears, or anything. I was just making sure you haven't bit your cheek, okay, while you were chewing or anything. So I am going to be taking a swab of that inside your mouth just to send off to the lab. So we do have to do another one, okay? Alright, so I'm just going to have you hold your mouth open, okay? And let me just get in there. Right this way. And then right over this way. Okay, now just stick out your tongue. I'm just going to scrape it a little bit. Okay, and then right here. Alright, so I'm just going to send this off to the lab again with the other one. And we should get the results back. Okay, So now I'm just going to check your lymph nodes again. Okay. And everything seems good. Okay. Are you experiencing any numbness, like in your toes or in your hands or anything like that? Okay. All right. Some in your feet. Okay. So what I'm going to do is I'm going to have you lay back. Okay. Just lay back. All right. And I'm just going to have you prop your feet up here. Okay. Just prop your feet up here, right here on me. Okay. Okay. So what I'm going to do first is I'm just going to take this brush and I'm just going to brush them to make sure that the sensation, okay, is there. Okay. So give me 1 second. Okay. Can you feel that? Okay, good. So then I'm just going to take this other one and I'm just going to roll it. I'm just going to roll it across there and you're just going to tell me if you can feel that one, okay? Okay, can you feel it up here on your toes? What about down here on your heel? Okay, and then right here? Okay. Okay, you can feel that? Okay, so let me just feel. You can feel all of this. Okay. Okay, that's very interesting. So what I'm going to do is I will note that down. Okay. And I will give you some medicine for that, okay? And it's just this right foot, okay? Is it? Okay, good. Alright, so wrote that down. So I'm just going to check your left foot just in case, okay? So I need you to just prop it up here. Okay, good job. And let me just see. I'm going to have to use a light on this. Okay, I'm just going to have to use a light on this one, okay? Let me just bring that in. Okay, so I'm just going to roll it on there. You can feel that all the way up to your toes. What about down here on the arch of your foot? What about on your heel? Okay, what about on the sides? And then what about on the top of your foot? Okay, alright, that's good. So I'm just going to massage that real fast just to make sure you can feel all over. And you can feel all that. What about when I scratch you like this on it? Okay. Okay, you can feel that? Okay, so it's just that one. Okay, not the left one. Okay, so I'm just going to top all this in. Your examination went very well. Everything seems to check out. I am going to write you a prescription for that, and I am going to send you to the dentist today, okay? Alright, I'm just going to top this in for you. Okay. And your name was Henrik? Okay, you've done a great job today, Henrik. I hope you know that. Okay. You will be back. I'm going to see you back in about a month, okay? Okay, and then the dentist I'm going to send you to is Dentist Marmalade, okay? She is a very good dentist, okay? So we're just going to send it here, and then I'm going to send, okay? And I'm just going to wait for your prescription. Let me just write that out. I'm going to give you your first dose here in office. Is that okay? Okay, so I am just going to be writing that out for you. So you're going to take this 3 times a day. Yeah, and it will help with that numbness, okay, in your foot, because I don't think it's anything bad. I just think, maybe you stepped on something and it hurt a nerve or something, but this will help it. Okay, alright, and then we just got back all of your examinations. Okay, so your mole is fine, so that's good. And then the inside of your mouth, okay, it is a cavity, so that's why I'm going to be sending you to the doctor, okay, to the dentist. Okay, so the dentist will see you. Okay, let me just email her real fast. Okay. Okay, so she can see you in 2 weeks. Okay, but until then, I'm going to write you this prescription. Okay, and I need you to take this with you, okay? Take this with you to the pharmacy, okay? Alright, so I'm just going to give you your first dose here. So, what I'm going to do is I'm just going to open it up. Okay. So, you're just going to get these and pop them out. They look like these little tiny pills, okay? That's all they look like. They just look like these little tiny pills. Okay, so I'm just going to take one. I'm just going to pop it out. Okay. Alright, and then I'm just going to take another one. Pop it out. Okay, so just open your mouth. I'm just going to give them to you. Okay. Alright, and you'll just chew them up. Chew them up. Okay. Alright, good job. And then you'll just swallow them. Okay, you need a little drink of water. Do you need a little drink of water? Okay, here you go. Alright, good job. So, I'm just going to, before you leave, just examine everything again real fast on your face. Make sure we didn't miss anything. Check your lymph nodes one more time. Okay, now swallow for me. Okay, now cough. Now the back of your ears. Okay, swallow. Now cough. Okay, and then check right down here. Okay. Okay, knock on this, knock on that. Okay, now I'm just going to check your shoulders again. Alright, knock on that, and then knock on this one. Okay, good job. And then I'm just going to check behind your neck real fast at the base of your skull. I'm just going to check behind your neck at the base of your skull again. Okay, I'm just going to bring it around. Okay, alright, so that did relieve a lot of that tension. So hopefully you won't be getting any more of them headaches. Alright. Okay, Hendrik, everything has looked good with you today. You got your prescription. I got you set up for another appointment with me in a month, and then I got you set up with another appointment with the dentist in about 2 weeks, okay? So everything checked out today. Thank you so much for stopping by your doctor's office.